Hey everyone, welcome back to the channel. If you're new here, my name's Nathan and I'm a second year medical student. We're about to start a new set of med-ed shorts where we talk about newborns and prenatal testing. In this first one, we're going to talk about standard newborn care. Alright, let's get to it. Hello everybody! Today we are learning about standard newborn care. So let's get started. There are two primary goals for our lesson today. The first is to learn what is standard newborn care, and then secondly, we're going to learn about different levels of neonatal care. So we'll begin with initial assessment of the infant after it's born. So there are three main questions that we're going to ask ourselves. First is the newborn's gestational age greater than or equal to 35 weeks? Next, we're going to ask, does the newborn have good muscle tone? And then lastly, is the newborn breathing or crying? So if the answer to all of these three questions is yes, we will proceed with the standard postnatal care. However, if the answer to any of these is no, then we might need to take additional measures. And this includes things like oxygen administration, positive pressure ventilation, chest compressions, resuscitative medications, or transfer to a higher level of care. So let's say that answer to all the questions were yes, and we proceed with standard postnatal care. What is that? So there are several important components of the initial care. The first is drying of the baby, clearing of airway secretions, providing warmth, and skin-to-skin contact and breastfeeding. And just to clarify the drying, this is what we mean by drying, not this. Alright, so after the initial care, the infant is taken to the nursery where some more steps are taken, and we'll cover those now. The first is eye care, which is delivered by erythromycin eye drops. So this is done as prophylaxis for potential gonococcal conjunctivitis. So some sort of infection that can lead to potential vision loss if untreated. The next step is intramuscular vitamin K injection, and this is given to prevent vitamin K deficiency bleeding, abbreviated VKDB. So vitamin K is important for our blood to clot, and so if there's a deficiency, then the baby's at risk for excessive bleeding. So that's why we give vitamin K. Next is hepatitis B vaccination, umbilical cord care, so cleaning and sterilizing there to prevent potential infection. Newborn screening, and this includes things such as hearing loss, metabolic or genetic disorders, and we test for that by placing blood smears on a test card like this, screening for potential congenital infections, and screening for CCHD, which is critical congenital heart disease. And then one other thing that is screened for is hyperbilirubinemia. And this can be done by visual inspection of the baby to see if there's jaundice, or it can be done by actually measuring bilirubin levels, either subcutaneously or in the blood. And then lastly, we have postnatal parental education. And this is crucial for informing the parents on how to properly care for their baby. Alright, so we know what is standard newborn care, and now we're going to learn about the different levels of neonatal care. So starting in level 1, this is the basic level of care. Then moving up to level 2, we have some specialty care and capacity for assisted ventilation, but only on an interim basis, not continuously. And then importantly, there's no capacity for surgery at level 2. Next up at level 3, however, this is recommended for infants born at gestational age less than 32 weeks. They have continuously available staff and equipment, and notably, they have capacity to do surgery and advanced life support. And now at the top of the pyramid at level 4, this is where we take care of the most complex and critically ill infants. And they have pediatric surgical specialists available all around the clock. So now I want to take a moment for some active recall, test what we learned today. So go ahead and pause the video and see if you can answer this question. Which of the following is not part of standard newborn care in the US? Okay, if you chose glucose screening, you would be correct. So according to the American Academy of Pediatrics, glucose screening is only indicated in a select number of instances, and this includes if the baby's gestational age is less than 37 weeks, if the baby is large or small for gestational age, if the baby has a diabetic mother, and if there's a family history of genetic hypoglycemia or there are suggestive physical findings of hypoglycemia. All right, that's all everybody. Let's summarize what we learned today. We learned that initial newborn care consists of drying, clearing the airway, providing warmth, skin-to-skin contact, and breastfeeding. We learned that the standard newborn nursery care comprises the big 6, which include eye care, vitamin K injection, hepatitis B vaccine, umbilical cord care, newborn screening, and lastly, parental education. And then finally, we learned about the different neonatal care levels, which are distinguished primarily based on the availability of equipment and staff. Okay, hope you enjoyed this video, everyone. Here are my references that I used if you would like to learn more. Like, comment, share, subscribe. Take care, and I'll see you in the next one.